are covering through the topics of anatomy. We start with the gross anatomy, which is very basic of anatomy. It's nothing about anatomy, but it is a very foundation thing. Now, these particular foundation things will be like carried through your true anatomy or gross anatomy. In anatomy, we split this section in three parts. We call them as embryology, which is known as developmental anatomy. We call them as microanatomy, which is known as histology, or we call them as gross anatomy. This gross anatomy is a broad thing, or big, like 80% of the loads of the class that we have, and that particular gross anatomy is the foundation stone for the next step. We call them as clinical anatomy. So, this gross anatomy question are clubbed together with the clinical scenario. We call them as clinical anatomy. So, basically, if you learn the gross anatomy, we can understand the foundation of clinical anatomy or the clinics or the medicine, surgery, gynae, obstetrics. Now, today we are going to start with the topic we call them as bone. This is very basic or very kindergarten class about bones. We already have an idea about bones, how many bones we have in our body, how many present in these regions. So, we have this particular bones or skeleton in our body which is present inside the skin. We call them as endoskeleton, and there are other types of skeleton. In some animals they have, we call them as exoskeleton, right? Just like a turtle, etc., they have the skeleton outside. We have this skeleton inside in our body, and this particular skeleton consists of two elements. One is bone, other is the cartilages. So, we will be emphasizing on the bones today, and later on as we phase through the next class, we will move to the other part of this skeleton. We call them as cartilage as well. So, this prime concern of this particular bone, how we are going to address in anatomy. Whenever you are going to study this particular bones, we are going to classify or going to tell about this particular bone, and this particular bone we have a foundation and addressing manner, how we are going to address it. Now, how they are present in our body, we address that particular bone in that particular region. So, if they are present in the midline, we call them as axial bone, and if they are present on the little side of that, we call them as appendicular bone. They are present in the arms and the limbs. So, if the bones are present in the upper extremity or lower extremity, that means the superior extremity and the inferior extremity, we call them as appendicular skeleton. And this particular appendicular skeleton combined with this particular girdles, we call them as pelvic girdle and pubic girdle. So, this pubic or pelvic girdle over here, and this particular girdle which is known as shoulder girdle, which is present with here clavicle and the scapula on the back, together form a kind of circular element. So, this region we call them as appendicular skeleton, and this midline we call them as axial skeleton. Axial skeleton principally consists of this particular skull or skull bones, facial bones, then we have the vertebrae, the ribs comes along with it, and the midline bone sternum over here, which is ending in this particular bone, we call them as sacrum and the coccyx. Along with, it's fitted with this particular bone, we call them as hip bone, we call them as pelvic girdle bones. They are present, and in the midline we have this particular bone fused to form this particular joint, we call them as symphysis fuse. So, this is how we can address our skeleton or endoskeleton or bones into two parts, axial skeleton, appendicular skeleton. Now, if we single out a particular bone from this particular like axial or appendicular skeleton, we can classify this particular bones into several parts. Now, how do they look like? We can classify it. We call them as morphological classification. Morphological, that means how do they look like, shape, size, etc., etc., length, breadth, width, shape, or any kind of abnormality which is present to it, we can classify it. So, if it is looking long, we call them as long bone. If it is looking flat, we call them as flat bone. If it is looking nothing long and nothing flat and do not have a proper defined shape, we call them as irregular bones. So, likewise we can classify it, and we had to know a little bit about how does these things look like. But prime emphasis on this shape will be focusing on long bones. That means we have to know what do you mean by the long bone. That means length more than width. So, length is long, which is the classical example is this one. We are call them as humerus, this one, and this one we call them as femur, tibia. These are the bone which is present in the arms and the legs. So, these are known as long bones. Now, if this long bone have a length and the breadth, and length is more than the breadth, we call them as long bone. It can be just like a big long bone or long bone, or maybe this shape is preserved, but they are short or length is short. We call them as short long bones, like this one. You look at they are looking like similar thing, like in the this particular skeleton of the foot, we have these particular bones, they are long, longer length is more than the width. So these are long, but these are short. We call them a short long bone or miniature long bone, just like small version, dwarf version of long bone. This is how we are going to take that. These bones, we call them as flat bones. They are look like flatter. Width is more, length is less, or may have a shape which is less, like a thinner kind of element is there. Sternum, which is present in front of this chest cage. This scapula, which is present on the back side, wing bone, we have this. So these particular bones are flatter. So these are known as bones, they are known as flatter in shape. So long bones, short long bones or miniature long bones, flat bones, they are present. Some of the bones which is present in the head and neck region, the skull region, they hold air. We call them as pneumatic bones. We call them as pneumatic bones. They are holding some air inside, or air cavity is inside. That means bone is inside a hollow, has a cavity. It can trap air. We call them as pneumatic bones. So pneumatic bones are classically found in this particular region. We call them as front side of this particular skull bone. So like the cheekbone, we call them as maxilla. We have a bone which is present in behind the cheekbone. We call them as ethmoid bones. They are present inside the face bone. Deep inside, they hold some kind of cavities for holding air. We call them as pneumatic bones. Now this long bone, flat bone, pneumatic bones or short long bones, they are there. But we may have some bones, they do not have any particular shape and size. We call them as irregular bone. Look at this particular bone. They do not have any shape over here in this region. They look like an amorphous, do not have any shape. We call them as irregular bone. So they are present in different directions. This bone, we call them as a vertebra. So vertebra doesn't have any shape to be compared with something else. So we can call this particular bone as irregular bones. This bone, we call them as hip bone. This hip bone is basically united bone for three different bones. They are coming together and uniting, making this particular single bone and giving no shape actually. That's why we call these particular bones as irregular bones. So these particular bones, we call them as long bone, flat bone, pneumatic bone or irregular bones. These are the general classification, how we are going to classify. Now tomorrow or next week onwards, we are going to study this particular individual bone. We will be addressing this is a long bone, this is a flat bone, etc., etc. We will be seeing that. Apart from this, there are ways within some kind of tendons, we may have some kind of bone formed. Those kind of bones, we call them as sesamoid. This particular bone is called them as sesamoid bone. So this kind of bones are grown within this particular tendons where there are chances or there are have much of friction there. So when this particular tendon is exposed to tremendous weight bearing and friction, it can develop some bones within it. So those kind of bones, we call them as sesamoid bone. So the largest of sesamoid bone, we call them as patella. You know the patella, knee bone? So that particular patella bone, we are not born with. That bone grows as because we start crawling, start jumping, start running, we have got tremendous friction on the tendon which is lying in it. So that particular tendon gradually grows some bone to avoid the friction, and with the friction it develops. We call this kind of bone is known as sesamoid bone. So this sesamoid bone, the classical or this biggest of it, we call them as patella. There are several other sites where these particular sesamoid bones are formed, like fabula, etc., etc. We will be seeing some other, but the best or classical or the catchy memorizing of the sesamoid or the example of sesamoid bone is patella. Now we have to know detail about this particular sesamoid bone as a short note. So we have to prepare this as a short note of sesamoid bone. You are going to prepare that the sesamoid bone as a short note. So whenever you are going to study this particular gross anatomy book through the resources that you have in the book or library book or online, you just get a finding 5-line short note on sesamoid bone, just 5-liner, nothing more. What you are going to find? The characteristics of sesamoid bone. What makes this particular sesamoid bone special or kind of different from other. So this particular bone, one characteristic is there, is grown within the tendon of some muscles. So you know the tendon is the tubular end of the muscles. So, if the muscle have two component, we call them as flesh of the muscle, that means middle part which has the muscle fiber, and as the muscle goes to the ends, it becomes tapered. So, that particular tapered end of the muscle we call them as tendon. So, within this tendon, this particular bone is formed. So, you have to identify or know this particular sesamoid bone, the characteristics of it, some example of it or the example, and what this particular sesamoid bone having special character of. This particular sesamoid bone have got no covering, it has no Havassian system, etc., etc. Those things we have to line it down, but remember that it should not be more than 4 or 5 liners. So, you prepare that for it. Sometimes you see that it comes as a short note, an easy short note will be there as sesamoid bone, and with an example, the best example of it, the patella, right? Good. So, this is one way we can classify the bones. There are other ways we can classify this particular bones based on how these particular bones are developed. Now, the bones are developing either from two sources. So, in our body, when we are growing inside this particular mother's womb, or we call them as uterus or in utero growth, our system or our body develops from tissues, we call them as mesenderm or mesenchymal tissue. Now, that particular mesenchymal tissue may have some membranous like appearance. Now, that particular membrane, if it is there, initial part, we call them as membrane which is formed over the mesenchymal element. So, that particular membrane may ossify, can transform to bone. So, we call this kind of change from membrane to bone, we call them as membranous ossification. What do you call them as? Ossification. That means the ossification is the process by which the bone is formed. So, ossification is the process how the bone is formed. It is a complex process. We are not going to go about it. We have to know the meaning of this ossification means. Ossification means formation of bone. Okay. Now, this particular formation of the bone can form from two sides or two things. The ossifications or the bones is formed either from membrane. Where from this membrane is coming from mesenchyme. These are embryological element, mesenchyme. If you cannot remember this particular mesenchyme right now, just don't. Remember this membrane. Or this particular bone is maybe formed from cartilages. So, bone may be formed from the membrane or maybe from cartilages, they may be transformed. So, this particular process we call them as ossification. Now, if the membrane transforms from membrane to bone, we call them as membranous ossification. If this cartilage becomes bone, we call them as cartilaginous ossification. If both of them are contributing, we call them as membrano-cartilaginous ossification. Clear? So, the logic is it may be formed from the or maybe cartilage or maybe both, depending on they are going to become the final element is this bone. So, how they are formed? We call them as ossification. Now, this particular cartilage formation, cartilage or this particular membrane, be it whatever. So, when they start to become a bone, so a part of that membrane or cartilage is a nodal point or the starting or beginning point of bone formation. So, for example, this point is the starting point of bone formation or ossification process from a cartilage or membrane. Assume this is a cartilage or membrane, whatever it is. So, if this particular plate over here may be cartilage or maybe it is a membrane, this point it starts formation of the bone at the first. So, this particular point where it starts to begin the deformation of the bone, we call them as ossification center. We call them as ossification center. That means this is the priming point, ossification center. It may be single, maybe multiple, maybe here, or maybe here. We call them as ossification centers, one or more, whatever. Clear or not? Yes or no? So, what do you mean by the ossification? Now, how this particular bone can be ossified? Or both? Now, when this particular ossification starts, we call that particular nodal point as ossification point. It may be one, maybe two, maybe plenty. It doesn't make any difference here. Ossification center or ossification points. It may be within this membrane or within this cartilage, doesn't matter, right? Now, this particular ossification points, if it happens to occur before we are born, that means in utero. What I am saying? If this ossification center appears or bone formation starts before we are born, we call that particular ossification point or ossification center as primary ossification point. We call them as primary ossification point or primary ossification center. And if it appears after we are born, we call them as secondary ossification center. Clear or not? Primary and secondary has got this basic difference. Primary means the first one which is happening. Now, if this first one is happening before we are born, we call them as primary. If that bone formation happens to occur after we are born, even if it is we are after born, we cannot call that as primary center. That will be secondary centers. Clear or not? So, primary ossification center and secondary ossification centers. So, what happens? When we are born, this primary ossification center starts to form these particular bones like this. So, maybe we have this particular 3 pieces of bones are formed, and later on after we are born, there are several other ossification points appears, which is known as secondary ossification center, and this secondary ossification center glues these together and makes this particular whole bone form like this. So, this is how these particular bones are formed from the centers, primary or secondary, before you are born, after you are born, maybe single or maybe multiple, maybe coming together, they are formed. Clear? So, based on that, we can classify these bones accordingly based on how these particular bones are formed in our body. So, we can classify this particular development of the bone as developmental bone classification. So, this particular classification we call them as developmental. How they are formed? Membranous bone, cartilaginous bone or membrano-cartilaginous bone. So, that means gives the history. Before this particular bone actually becomes bones, how their ancestors were there, if they are cartilage or if they are membrane or if they are together. So, that is why you can classify that. So, this particular whole thing we call them as classifications of these bones. They maybe have a morphological classification, that is what we are talking about, how do they look like, long, short, flat, etc., etc. So, we call them as morphological classification. This one we are known with, so far we discussed about. This one we call them as developmental, we already know about. Known as regional, how they are placed in our body, midline or on my arms or regions of the arm, appendicular or axials, how they are present. How this particular skeleton is there in our body, outside the skin or inside the skin, exoskeleton or endoskeleton, and they can be classified. The third element we call them as structural. That means if it is microscopic having feature or not. That means if you come to histo classes, we will talk about some bone structure in microscopes. In gross, that is what we are going to do, how they look like, the gross features over there. So, microscopically bones can be divided into several complex structures like lamellar, oven, dentine, segmental, etc., etc. But macroscopically, like when you hold this particular bone, we can classify the bone into two parts, compact bones or spongy bones. This compact bone and spongy bones we will talk about in this part. So, this is how bones can be classified. This is all about we are talking here. So, how these particular bones are there, how the short long bone etc. is there, and how they are classified, we have a rough idea. As we progress through the different contents, we will learn across. So, this is about what we are talking about, ossification point, ossification center. We are clear about primary and secondary, before we are born, after we are born. So, this is how this starts to appear, like ossification centers. Like you see that the 5th and 6th week, it starts forming on this particular skull bones and clavicles. They are still a membrane, and within this particular membrane, this particular ossification starts to happen in clavicle and this skull bone. Clavicle means collarbone. It's the 5th and 6th week. That means after fertilization. Long bones, 7th to 8th week, it starts begin to form. Like means arms, we have this femur, humerus, radius, ulna. 7th and 8th weeks, that means 2 months of age, we start growing by bone. So on, so on. And last one which goes here, 9 months, lower in the femur, they appear secondary, a second ossification center, like second ossification primary center. Still we are not born, that means it is still the primary centers. As I am saying, the primary center may be 1 or maybe 2, doesn't matter, we are not going to count. If it is before, we call them as primary. If it is after, we call them as secondary. This simple rule. So, this is what we are going to talk and finish our discussion with today about this particular bone. So, we take an example of a long bone and narrate the different parts of the bone. That what we have to understand here about this particular bone and the gross features of the bone as we move through. So, this particular example we are putting over here is a long bone, and taking this particular long bone, we are giving different parts of a long bone or growing long bone parts. So, this particular individual bones, if you catch it, we can have different regions of the bone present, upper end, lower end, shaft, etc., etc. But for general discussion of a bone, we can have a different parts of a bone which is present. So, a growing long bone have got different parts. We call them as shaft, we call them as ends, we call them as plates, and we call them as inner stole or inner part, marrow cavity, and as well as this particular adjoining regions. So, let me explain this particular region. You should have a very clear idea about this particular different parts of a growing long bone, because this is how we test you in examination. I will throw some questions that makes you clear how we are going to ask the questions. Now, see. So, this is a long bone you are seeing here. The example over here is a humerus. That means this bone which is present in the upper arm we have picked up. Now, this particular long bone have got two ends. This middle part we call them as middle part region, and this is we call them as ends. It could be upper end, it could be lower end, depending on how this particular bone is placed. Now, this middle part over here we call them as shaft. When you call it anatomically, we call them as shaft. The shaft is the middle part of this particular bone. So, this shaft we often refer here, but in a gross terminology, this shaft part we call them as diaphysis. You have to know what do you mean by the diaphysis. So, this particular middle region, shaft region, we call them as diaphysis. This is the strongest part of the bone. What part? This is the strongest part of the bone. This gives the strength of the bone. The diaphysis of the shaft, if it is strong, we get a strong bone. It takes maximum load of our body. So, whatever the body weight we have, whenever we are jumping, running, it loads more. That particular load is based on the shaft. If the shaft is weak, it cracks. If your shaft, we are having a weaker shaft because of some diseases, it cracks. So, then we have the fractures of the bone. Now, this part we call them as diaphysis. Now, these two ends, we call them as epiphyseal end. We call them as epiphyseal end. This upper end and lower end, we call them as epiphyseal ends. We have to know what do you mean by this epiphysis. So, this epiphysis develops from secondary ossification center, and this shaft develops from primary ossification center. Now, what is primary ossification center? What is primary ossification center? Primary ossification center. So this particular primary ossification center yields this particular diaphysis. The secondary ossification center gives this particular ends of this, we call them as epiphysis or this particular element. Now this epiphysis, in between this particular epiphysis and this particular diaphysis, we have a cartilage existing. This is most important part. This cartilage which is present in here, we call them as epiphyseal plate or epiphyseal cartilage. Now write it down, epiphyseal cartilage. Write it down, epiphyseal cartilage. Epiphyseal cartilage, write it down. Prepare a 5-line short note of epiphyseal cartilage. 5-line, okay? That's your homework. 2 of them, not measure or nothing's less measure. This is one criteria. If this ossification appears before birth, we call them as primary. If it appears after we are born, second. One thing, simple rule, right? Highway or my way, strongest part, all right, we'll come across. But you identify this part first. One is diaphysis, which is developed from primary ossification center. That means the bone starts to grow from the diaphysis in a long bone. And diaphysis is this particular area of the bone which grows the strongest part of the bone. Then we have these ends of the bone, which is ends of the bone, we call them as epiphysis, which is on the sides of the bone, upper and lower end. It grows from secondary ossification center. That means before we are born, afterward. So this particular end of this particular bones form or starts forming after we are born, 9 months. So still we are just like lying on beds, jumping or trying to jump, this particular bone is growing. So this particular in between epiphysis and the diaphysis, we have a piece of cartilage existing. We call them as epiphyseal plate or epiphyseal cartilage. Now this particular epiphyseal plate or epiphyseal cartilage grows. That's why this bone grows. Clear what I am saying? This epiphyseal plate grows in length, and that's why these particular bones grow in length. If it fails to grow, this epiphyseal plate, we do not have a bone growth or we have a stunting of bone growth. That means it will the person will be dwarf. If by any diseases this particular epiphyseal plate is destroyed, the bone is not going to grow. So if the bone is not going to grow, we are not going to grow in length. So that's the significance of epiphyseal plate. So this is the part which is taking the load, diaphysis. This is the part, epiphysis or epiphyseal plate, which helps the bone to grow in length. Clear? So epiphysis, diaphysis and epiphyseal plate. Now as we progress towards this particular growth or maturity of ages, like pubertal age is over and we are going to get this particular adulthood, this particular epiphyseal plate slowly growing and fuses with the epiphysis with the diaphysis. So then this epiphyseal plate changes the name and morphological part becomes a very thin line, we call them an epiphyseal line, and that particular region we call them as metaphysis. So metaphysis is the part of diaphysis which is close to the epiphyseal plate. So I repeat again, we have diaphysis, that is shaft, we have epiphysis, that is 2 ends, in between them we have the epiphyseal plates. Epiphyseal plate grows, elongates, that's why the bone grows. And as because we are going to get a mature age, this particular epiphyseal plate growth slowly slows down and becomes a line, we call them as epiphyseal line. Alright, it fuses. The epiphysis fuses with the diaphysis and the epiphyseal cartilage is replaced and becomes bone, becomes ossified. Now, that particular region of diaphysis which is close to the epiphysis, we call them as metaphysis. So we have 3 parts in a bone. So if we have a long bone like this, Epiphysis, and this end of diaphysis which is close to epiphysis, we call them as metaphysis. Now this metaphysis is important, rather very important, because this particular metaphysis is close to this part of epiphysis. We call them as epiphyseal plate. Why this epiphyseal plate is important? Because it helps us to grow. Now if it helps us to grow, it needs more nutrition, more blood supply. So this particular metaphysis region has to be very secured place, or else we have trouble, or else this blood is not going to flow to this epiphyseal plates. So we have a trouble if you do not have a secured metaphysis. The significance of metaphysis we will discuss next day, but we have to understand these basic elements over here about metaphysis, diaphysis and epiphysis. Are we clear with these three terms or not? Clear? Metaphysis, epiphysis, diaphysis, epiphyseal plate, the significance of epiphyseal plate. If we have destroyed epiphyseal plates, we have a stunting of growth because bone are not growing, especially the long bones, short bones, any bones. Clear? Change করে একটু আবার ফেরত আসবে আরেকটু কর. So this is what we call them as zone of proliferation of the epiphyseal plate. So within this epiphysis cartilage or epiphyseal plate, there are some zones are there. There are some cartilage cells are there. We call them resolved cell, proliferating cell, mature cells and calcified cells. So they are bottoming out like this. So they grow like this. I want you to prepare this particular thing as a short note, 5-liner. You do not have to dig deep into this particular zone, whatever these are there. This is for a further identification, not for undergrads. For undergrads, we have to know the clinical thing of epiphyseal plate or epiphyseal cartilage. 5 lines, that's it. If it is growing more than 5 lines, cut short. That means you are taking extra thing which is not required. So don't take extra loads, 5 lines, alright? That's it. So this particular epiphysis, as we are saying, parts of the things. This is what we are talking here. Now, other than this particular ends, this particular whole long bone is covered by 2 membranes. One membrane is present outside, one membrane is present inside. The outside membrane we call them as periosteum or outer periosteum. Now this cavity, which is, if you cut here, we have a cavity within this diaphysis. The inner side of this particular bone is lined by, or inner table of the bone is lined by another membrane. We call them as endosteum. So if you see that from outside to inside, we have this periosteum outside, then we have the bony cortex, then we have a cavity, we call them as medullary cavity. Then that medullary cavity is lined by this particular endosteum, and inside to it, we have this bone marrow which is present in here. So this particular bone marrow is a cavity present within this diaphysis. This particular middle space, if you cut open, you get a inside cavity or tunnel present. That particular tunnel we call them as marrow cavity. So that particular marrow cavity present within this diaphysis, we call them as inside or bone marrow. So this particular bone marrow are of 2 types. One we call them as red bone marrow, other is known as yellow bone marrow. So red bone marrow, at the particular marrow which is present on this upper end of the diaphysis, which is close to the epiphyseal plates. So red bone marrow is present on metaphysis region. So this metaphysis region holds this particular bone marrow. We call them as red marrow or red bone marrow. They are producing the blood cells, RBC, WBC platelets. They are coming from bone marrow, which are known as red bone marrow. Now this middle part of the diaphysis, which is occupied by other type of marrow, we call them as yellow bone marrow. Yellow bone marrow, that is occupied by the fats. That means they are basically living cells but packed with fats. So if you keep this particular thing hollow, it will be making some sounds. So our legs will be making some musics. So if it is hollow, so the nature packed with this particular bone marrow, which is replaced, cannot work with some fat tissues, packing material. কাজের কাজ কিছু করতে পারছে না, ঠিক আছে, কিছু তো মাল সামলা, গুদামের জিনিস, সো গুদামটা প্যাক করে দিয়েছে। So that particular yellow bone marrow is basically a replaced red bone marrow packed with the fats. So coming back once again, parts of the bone, diaphysis, epiphysis, in between that we have the metaphysis. Metaphysis is that region which is basically close to the epiphyseal plate. We understand the epiphyseal plate is a cartilage which grows the length of the bone. If that particular epiphysis plate is not working well, we have no growth. If the diaphysis is weak, we get a chance of fracture of the bone is very high, and diaphysis is developed from this primary and epiphysis is developed from secondary ossification points. Now this particular whole bone is covered by two kind of covering, outside covering, we call them as periosteum, inside endosteum. Endosteum is covering the cavity inside the bone, we call them as bone marrow cavity. Bone marrow cavity is occupied two elements, we call them as marrows. Marrows are of two types, red marrow or yellow marrow. Red marrow producing the blood cells. Where they are present on these metaphyseal ends. That means the epiphyseal plate. We find the red marrow inside. We cut here, we find the red bone marrow. In the middle, we find the fat cells or yellow bone marrow. Yellow bone marrow is a packing material. That means dead bone marrow is replaced with. So this is all about this particular parts of the long bone. We will just take up from here. Next day, prepare the two short notes about sesamoid bone and epiphyseal plate, 5-liner, 4-liner short note. That's it, no more than that. And the clinical significance of that sesamoid bone and the epiphyseal plate will add to it. Clear?